Hello, everyone, and welcome back to another episode of Manifesting Health. We're really excited to have two individuals from VITAS Healthcare, one of our premier partners that we've been with for many years, almost 10 years now. So we're very excited to have with us two individuals that's going to help talk about some of the space within end-of-life care, palliative care, and hospice within our population. So let's first welcome Jason Cooper. Jason Cooper is the National Spiritual Services Lead and Chaplain at VITAS Healthcare, supporting over 300 chaplains and spiritual caregivers across the country and the organization. He's dedicated to helping patients and families find comfort and meaning in life's most vulnerable moments. Thank you, Jason, for being here.
Thank you.
We also have Dr. Heather Veeder. Dr. Veeder is a regional medical director for VITAS Healthcare, overseeing locations across Texas, Illinois, Kansas, Missouri, and Wisconsin. Quite a few, Dr. Veeder. Along with her passion is about goals of care, conversations, and helping patients and families focus on what matters most at the end of life time. Thank you, Dr. Veeder, for being here.
Thank you.
Excellent. Thank you both for being here. And what we normally start with is I want to give you a little opportunity to tell us about yourself and how you entered into the space of palliative care, hospice, and end of life, but specifically within VITAS. So Jason, can you start us off? Tell us a little bit about yourself and how you ended up in the space you're in now.
Absolutely. I served in two different churches for about 20 years before stepping into the clinical side of chaplaincy and spiritual care. After recognizing the difficulties that people were facing when they were dealing with major, traumatic issues. I've worked in a couple different hospitals as a chaplain. And one of the things that has really it stoked my passion was getting to people when they have not only experienced a loss, but working with the families after the death of their loved ones. And that's one of the things that I get to do in my role now. Is to really support not only the 300 plus chaplains that you mentioned, but also our 50 or so bereavement managers. So I get to really work with families and people and supporting and providing for those families after the fact. It's one of the things that I love about the hospice model is that we don't just leave the patient or don't leave the family when the patient dies. We stay with the family. We actually provide up to 13 months of support post-death. So I get a chance to really live into that passion of, helping and support people in dealing with the loss of their loved ones. So I started as a field chaplain, worked as a bereavement manager in the Orlando area, and now in the spiritual lead role, working specifically with our patient and family supportive services department.
Thank you. I appreciate your overview and appreciate all that you're doing within that very important work for our patients and families. So thank you. Heather, would you like to introduce yourself and tell us a little bit how you got into the VITAS family?
Sure. So I'm actually late to medicine. I graduated med school when my daughter graduated high school. So we did not have shared parties. I didn't do that to her. But my plan, knowing I was going to medical school, right, was to get through and to start working, right, pay off my loans as quickly as possible. But then I realized I needed to be in hospice. I needed to be somewhere where people really needed the help, really needed support. And I moved to San Antonio and did a hospice and palliative fellowship and got connected to VITAS through that. So I joined in San Antonio as the medical director, and then when my predecessor retired, I moved into the regional medical director role. And I never expected to be working for a large company. I thought I was going to be one of the mom and pop places, but we are mom and pop in each of our places. We're all local, and with the resources to be able to meet the needs of more people in more ways. And I wouldn't be anywhere else.
Excellent. Thank you so much. It's an interesting story, like you said, starting in medicine late, but brings a different perspective because you have experiences in that helps inform what you do for your families and your patients. So that's an incredibly powerful tool. I want to continue that conversation of what you mentioned in there within the hospice, palliative care, end of life space, on how you got to a point of really helping those patients and families in some very difficult times. How did you how you know VITAS is a very large organization, of over 50 different locations, different programs, so forth, the 15 different states. You're seeing over 22,000 patients a year at least. So there's a lot of there's a lot of engagement points within families and caregivers, both male and female caregivers. How do you keep your sense of direction, but also keep filling yourself with that sense of purpose? This is a very difficult place to be in. So VITAS, how does VITAS help you and you help VITAS in this ongoing effort when it comes to meeting the needs of the patients in a very difficult time?
Well, I would say the way VITAS helps me is that I have a lot of autonomy in what I do. And the majority of my job is supporting the programs that I'm connected to and supporting especially the medical directors. And how do we best provide the care? We're making sure the medical part is what it's supposed to be, but we're also really engaged in the the human part, right? The psychosocial part. And right now I'm focusing on a project of how are we connecting with our patients, even with our admission nurses?
Mhm.
Is what we're saying, is that speaking to the person, not just what's your diagnosis?
Mhm.
Here is your this is how much time you have left. That's not what it is, right? Death is too medicalized,
Mhm.
and I give orders, but they're suggestions, ideally in a shared decision making model, and that that brings a lot of fulfillment. And then I also have the opportunity to still stay active in seeing patients,
Mhm.
and that'll always ground you, right? It's, I think, easy if we don't see patients enough and families to lose our focus, but that definitely brings me back.
Right. And I want to hear from Jason with that, but this is a lead into another part of some of the things that we want to cover is how do you remain with that human, patient,
Mhm.
family-centric approach in an environment that's so volatile sometimes, whether it be regulatory, political, whether it be, laws, whatever it might be that's happening around us, constant reimbursements and different, organizational buyouts. And so how do you keep that family patient approach and focus in such a difficult time like we're seeing right now?
Yeah, I one of the things that I love about the role that I get to play and really working with our social workers and our chaplains, because that is the beauty of the hospice model, is that there is an interdisciplinary team that collaborates, like Dr. Veeder was saying, that they collaborate together, that they work
Mm.
together to bring care to the whole person, not just the medical side, not just this is a person who has a diagnosis and there's a prognosis and here's the symptoms and here's the medical things that we need to do. There's another side to that
Mm.
that I think is an incredibly powerful side of that. And that is the psychosocial, the spiritual, the mental, the emotional support. And our chaplains and our social workers do just that, is they bring that level of care to say, hey, we don't just see you as a number. In fact, I say this all the time. Every one of our patients has a medical record number. The difficulty is, or the temptation can be, that we only see the person as a number. But the psychosocial spiritual side of things, we constantly remind our teams that every time we're looking at a number, every medical record number has a name, and every name has a story, and every story matters. And so we try to just keep that in front of our people all the time so that we never lose sight of the fact that we are just human beings taking care of other human beings in a very powerful way, but just reminding them of the nature of the work that we do. And it's not for everybody, to your point. It
And
is
there's
it is very
constant
difficult.
noise.
Yeah.
That's so true. There's so much constant noise around us in so many different avenues, from media to print to social, whatever news, whatever it might be. There's so much noise that's constantly around us that we get so distracted from the humanistic piece. And I'm so glad that you said that. And Heather, I want to hear from you in that same avenue. Is with all the different challenges that you're seeing from the medical side, how do you keep your team engaged all your providers, because it's an interprofessional team that you're working with in these different regions. How do you keep them maintained in a way that's keeping the human-centric approach? Because that is so valuable, not just in VITAS' space, but in all healthcare for that matter. How do we keep that approach so grounded and truly while we're here and not let all the noise distract us?
We do make sure that we are focusing on that, right? Our first value at VITAS, the values sound corny, but they're true. They really are. Our first one is that our patients and our families come first. Our second is that we take care of each other.
Mm.
And for me, yeah, maybe they're one and two, but I can't separate those out in importance, right? If we take care of each other, that allows us to make sure that that patient and family have the support that they need. And I would say also the people that I work with, regardless of what letters come after their name, most of them are very focused on the person, right? What do they need? The medical directors that I work with, this is one of their main goals in what they're doing from day to day is ensuring that everybody feels that way, right? And if somebody is getting burnout, if somebody is struggling in caring for a patient that has radically different beliefs, we have the rest of the team to support us. And maybe I should give this to Jason, because your team is the team that we go to when we're struggling with these things.
Yeah, Jason, absolutely. Tell us how you continue that.
Well, I think one of the things that, speaking back to what you were saying about the noise in the system, so to speak, there is a lot of noise. And one of the things that we work specifically with Medicare, Medicaid, so we work with the government. And one of the things that we constantly monitor is the feedback that we're getting from our caregivers after the patient's death. So we're constantly listening for, the CAP surveys to find out how did they find our care? How do we do for them? And one of the things that I love about our specific department with patient and family supportive services is that we have an executive vice president who's over the department who literally says it's not about the CAP scores. That's great. Those are great, but we are about doing what is right for the person. If it's what is right for the person, that's what we're going to focus on. And here's the thing. If we take care of our patients, if we take care of our families, the scores take care of themselves. We don't provide care to scores, to surveys. We provide care to people. And so it is a constant beating drum of us saying to our caregivers, and like each one of our programs across the country, is just to be reminded in those moments when it's difficult, when the stress is high, when your energy is completely low, your tank is empty. We constantly remind them of why we do what we do. It's because it's the right thing for us to do. And I love what Dr. Veeder said. I'm right there with her. And those values that we have, they are literally lived out. And I've seen a number of organizations with values that they put on a wall or something. And it's kind of like, oh, they're just, that's kind of our mantra, but they really don't live those things out. Those first two that she mentioned are absolutely critical to the mission and the purpose of VITAS Healthcare.
It's great. This conversation has been very fulfilling to see how you all collectively work with the patient in the center, and you work from all angles, you work from all approaches, you work from all different levels. And this is a powerful tool. And I know other organizations that are similar, or other healthcare entities, whether inpatient or outpatient, many of them have this same sort of culture that's built over time. So I appreciate what you're sharing as yet another exemplar on how the patient truly, regardless of where we are, regardless of our specialties, regardless of our population we're caring for, when you have that patient center and that family center approach, that's when you build your successes in a very positive and meaningful and sustainable way. And one of the things that can be a huge challenge for populations, specifically those in your population of end-of-life, palliative, and hospice care, is when you have a male caregiver, because many times the males in those relationships or partnerships or in those entities within families may not have been the primary caregiver. And now they're caring for someone in their end of life or in their palliative status or hospice status that they may have a lot of adjustment in a characteristic or stereotypic role. Can you tell us a little bit about how you address the specific needs for the male caregiver in those spaces, both in the spiritual space, but also in the care space? Jason, let's start with you.
Yeah, it's interesting that that dynamic, because there's so many times. I think there's two different sides to it. I think we have our male caregivers that are professionally hired on the teams, but then there's also those male caregivers like a husband who is
Right.
now the primary caregiver for a wife that they've been together for 50, 60 years, and he didn't cook, she cooked, or maybe she did all the signed the checks and wrote the bills out and everything. And there's that shift where for so long a spouse is taking care of the husband, but the husband is like, what do I do now? So for us, a lot of times those conversations, like with the medical side, an RN's going to go in, they're going to look and they're going to see what are the things physically that we need to do to kind of mitigate symptoms. For a social worker or for a chaplain, we're going to go in and we're going to sit across the table from that male caregiver and just say, let's have a tough conversation. Like, what is it that you need right now? What do you need to know? How can we help you step into a new role? Because this is something you've never experienced before. And to be quite honest with you, especially with an aging population, there are a lot of the men that we run across in our work day to day that they came from an era where they were the breadwinners, right? They were the ones that were out there conquering the world, and their spouses were the ones at home kind of taking care of things. And now all of a sudden they have to be shifted into this role. So it's a very intentional, purposeful conversation that we need to have that will hopefully set them up, and we can give them the tools that they need to feel confident, to feel like they actually know what they need to do to provide care for their loved one the best way possible.
And a lot of times it's a rapid shift. It can be a sudden onset thing where you really don't have an opportunity to grieve a life you've known for the 50, 60 years, as you just demonstrated, into a space of all of a sudden there's a stage 4 cancer diagnosis and it's fully metastasized. Or that's just one example. There's many other ways to enter your service line. How, that right there, that male caregiver is, I'm adjusting to that, changing everything. I may still be employed in some cases as a financial resource. And now we have this on top of that. So Heather, how do you approach, medically, obviously, how do you approach the male caregiver to help them understand that skill and what they need to move into a space of now caring for that individual long-term?
I think it very much depends on them, right? Because I think I've seen so many men who are amazing caregivers to their wives or their mothers, right? We see a lot of that. And I think that's often especially hard with that dynamic, right? For a son to change his mom's diaper, that's often really hard, right? It feels more normal for it to be the daughter, right? And some men transition pretty easily. Others, it's really a struggle. And it takes patience, and it takes a lot of times, it may just be, we need to show someone how to do it. Right. That's, I think, probably one of the biggest fears is I don't know how to do this. I've never actually changed a diaper. What am I supposed to do? What is this cream like for wound care or something, right? So these are things, especially like you were saying, Jason, that they haven't done before, right? And so I think that's a really big part of it. But the other thing that really strikes me is we know that caregivers in general sacrifice themselves to care for their loved ones. And I don't have data on me, but I bet I can find it, that male caregivers probably sacrifice more than females, because they really aren't going to the doctor. They really aren't taking care of themselves in preventive care or treatment. And that's one of the things that we can do. It's not their medical part in providing care, but maybe that's us providing a volunteer so they can do
Right.
that. So
That's a powerful message to recognize the male caregiver needs is so complex.
Mhm.
It's not, oh, is a new condition, let's adapt to that. It's really multifactorial. So I appreciate both of your approaches in that and both your conversations. So, as we're closing out, this has been a great conversation. I really appreciate it. As we're closing out, I want to give our listeners a little bit of a takeaway. So, Jason, what do you have as a takeaway for those listening to us today and learning more about the palliative hospice and the end of life care space?
Well, I think one of the things is really, really getting hospice involved early. If there is a diagnosis that is not looking good, it's not just sticking your head in the sand, especially for men. And we are so bad at taking care of ourselves, just like Dr. Veeder was
Yes, we
saying.
are.
I
Yes, we
mean,
are.
I was reminded just briefly when she said that, I was reminded of a caregiver that I had back when I was actually in the field, a patient who was a father and the son was the caregiver. And you talking about just major conflict, like he was losing his dad and there were just this, he was angry at his dad because his dad was supposed to be the primary person he always looked up to. And so there were all these things. But the one thing that I loved that came out of that conversation with the son was the son's need to be there for his sons when he was older. So I think one of the takeaways for me is to, number one, for men to take care of themselves. I mean, Movember is awesome. I love No Shave November. In fact, I've been doing it for years. I just forget that it's not No Shave November anymore. It's January. I'm just like, I'm going to just leave it.
Yeah.
But I think that that's great, but it also needs to be a year-round thing for each one of the men that are out there, that we take care of ourselves, that if we do see that there is something, or we get a diagnosis, or we get a prognosis of 6 months or less, get hospice involved sooner than later so that we can begin to have that conversation and to prepare the family, prepare you as the patient, but be ready to have those difficult conversations to be prepared for what's coming next.
Excellent. Thank you so much, Jason. Dr. Veeder?
I feel like there are so many takeaways we could have, but I think that one, that asking for help or asking for advice is one of the, I don't want it to be a brave thing, but it often is a brave thing, right? Because these are things that are hard to discuss, right? I don't want to ask this question because I really don't want to know the answer. And that is on all of us to do that. When we talk about starting the conversation, that's one of the things that the responsibility lies on everyone, so everyone kind of steps away. But
Right.
even just the questions of, whether you're the patient or the caregiver, it's, what's important to you.
Right.
It doesn't have to be medical, but I think starting that conversation wherever somebody is in their life is an important question to ask. And it's open, so people can answer in whatever way they feel comfortable, but it's at least starting that.
Thank you for that perspective. Heather and Jason, thank you both for your time with us today. We really appreciate you sharing your stories, but also sharing the encouragement piece of what can be a very difficult time for many people. But we also thank you for your time and effort. So thank you.
Thank you.
You.
And thank you all for listening to us again. We're very excited to have you join us and look forward to seeing you next time on the Manifesting Health series.